Welcome to Kanawha County Health Report from Kanawha-Charleston Health Department. I'm Dr. Sherri Young, the Health Officer and Executive Director for KCHD. On this episode, Health, Fire, and Brimstone, Fire Safety and Prevention. Our guests are Bob Sharp, Chief Deputy State Fire Marshal for the state of West Virginia, and Courtney Rosemond, Public Information Specialist. Welcome, both of you.
Thank you.
Thanks for having us. So first of all, tell us about the State Fire Marshal's Office and the role in investigating fires.
Well, I'll start off to tell you a little bit about our agency because a lot of people have some wrong ideas about it. But this year we're celebrating 110 years, so we're the second oldest law enforcement agency in West Virginia. So we are associated with the fire service, absolutely, but we are kind of the law enforcement branch of the fire service, and we have three divisions. We have a fire inspection division, which goes out and inspects buildings and enforces the fire codes. We have an investigative division, and they go out and investigate fires, and when they find people that set something on fire when they're not supposed to, they arrest them, and then sometimes there's convictions that follow after that. Then we have our fire services division, which takes in a multitude of licensing programs like electricians. So if you want to be an electrician, then you take our examination to become an electrician, and same thing for fireworks and blasters and just a lot of licensing things. And then we evaluate fire departments. So we go out to approximately 80 fire departments every year, and we evaluate them on their training to the standard that we have in West Virginia, and also their equipment to make sure that they have the proper equipment to do their jobs. So we don't have total oversight of our fire departments. People think that. But we do look for their training element and their equipment part of it, and then things like workers' compensation and liability insurance too. So we do all those things with only about a total of civilians and sworn law enforcement of 58 people, where we're totally have our attendance and everything up. So
tell me, what are some of the most common causes of fire that you see?
Oh, well, cooking fires always comes to the top of the list, unattended cooking and things like that. And then improper use of smoking materials. We've seen a lot of that, and we can trace that to a lot of about 50% of our fire deaths actually. And then electrical causes in houses.
Colder temperatures are just around the corner, so what are some things that people should remember about using things like space heaters and keeping them safe?
You know, it's funny, on fires, you can always start to see an uptick in the fires and things as soon as people start turning their systems on and using alternate heating methods and things like that. So some recommendations that we have is to make sure that the Underwriters Laboratories, UL, that they actually have those listed and they're approved, that they give them some space, like 3 feet from every side. Like, so if you have a kerosene heater, for example, you want to keep everything a yardstick 3 feet from it, so it doesn't get to a temperature where it might self-ignite. And then plug things directly in the wall. We hate extension cords. They are not our friend. And people a lot of times will daisy chain them together. What that means is you take more than one extension cord to make the distance. You need to either get a new receptacle put in that's closer where you need it, or have a line so that you can reach it just from the cord.
If you ever ask or have any questions, you can ask your local fire department to check it out. They're happy to do it. We have a lot of volunteers in the state, and they will look at those, make sure you're being safe, or even give our office a call. We always have some of those tips on our website, and especially when those temperatures start to drop. We like to push out that information as people are turning on their heat and things like that.
So looking at the data from the National Fire Protection Association, West Virginia has historically had higher than average rates of fire deaths. What is contributing to that? What do you think that is?
Well, we'd like to pinpoint that. If we knew it exactly, that'd be awesome. But some of the commonalities that we come up, we have an older population of seniors. So we have a lot of seniors that die in fires here. So that's one of the reasons. And then socioeconomics, low income, so that's another thing. And people using alternative heat sources because of those things. We have a lot of smokers in the state, so that attributes to a lot of our fire deaths here too. And then, like most states, but here maybe especially because we have such a small population statewide, 98% of our volunteer our fire departments are volunteers, so it takes up to about 10 minutes sometimes, depending on the time of day, for volunteers to get to the fire station and get to your house and things. So there's a delay in time. So those are a lot of the reasons.
So let me ask, when you are investigating a home fire death, how often do you find that the home had no smoke detectors?
Usually it's about 50%, but when we say that it's 50%, so half of them, only really about 20 of them are actually operational and functional. A lot of times our investigators, they really are focused on finding that information out. If there is anybody surviving in the fire, did you hear it? Asking the fire department, did you hear those smoke alarms going? They will go off. We've done a lot of experiments and videos and things like that in our own agency and then also nationally. So they're going to go off pretty much the entire time of that fire. We did one recently, actually, and the fire was going for, I think it was like 23 minutes, and the smoke alarm stopped at about like 13 minutes because it had fallen off of the wall because it just melted to that point. But, a lot of them are not functional. They're not up to date. They may have them. Unfortunately, we've had some horrific fires where firefighters have gone back and found the alarms in drawers, still in packaging. So that's something we're really pushing, is to make sure that you have them. It's great to have them, but make sure that they are less than 10 years old, they're operational, we're checking them, things along those lines.
That's a very good point. Not only do you need to have the fire detectors in your home, but have them operational in a good place. So what are some of the most common excuses you hear from people when they don't have smoke detectors?
I think it's just one of those things that a lot of people they just don't think about it. They don't think a fire's ever going to happen to them. And, I'll get to it. It's one of those things where it's up in the air and you just, we have, unfortunately, we talk about community risk reduction and changing of the American family and the way we approach education and everything. And everyone's got their cell phone. We're trying to fill up every moment of the day. It's one of those things that it's really overlooked. That's why we have partnered with the American Red Cross and with the fire departments, and it's all about getting them installed. And fire departments will install them. We will install them. The American Red Cross will install them. But I just think it's one of those things that it takes 5 minutes, and people are just, I'll get to it. It's one of those.
So if you are a do-it-yourselfer and you are wanting to install your fire detectors in your home, where should those be located?
So obviously, I like to tell people a smoke alarm is really an alarm clock to wake you up when you're asleep. If you are awake, you should smell the fire, see the smoke, all those kind of things. But when you're asleep, it's a whole different ball game. So what's going to wake you up? A fire is just not going to wake you up. The smell of fire when you're asleep is not going to wake you up, and it may not be noisy enough to wake you up. So it's an alarm clock to wake you up. So they need to be located in places where you sleep. Like in your bedroom, right outside your bedroom. If you take a nap in the living room, you should have one, close to that area. So just think of them as alarm clocks to wake you up when you're asleep. And because that's what usually happens is people go to bed or they fall asleep and then they wake up to, I'm trapped in my house. I can't get out. And today that's really the push we have is not only to give people smoke alarms, but to install them in the proper places. And like you said, some other places people do is like in their kitchen. They think, we talk about cooking fires. Well, there are some made right for the kitchen, but nobody sleeps in their kitchen, or very few people sleep in their kitchen. And grease, sets them off and things and covers the sensors. Same thing about around your bathroom. The steam from the shower or the bath is going to make those go off, and they're going to be a nuisance.
So I do want to ask, are there any type of smoke detectors that work best? Is there a preference for any ones that you feel work better than others?
I always get asked that question. It's really funny because and you see on TV sometimes, you'll see some specials and the two different types of smoke alarms, photoelectric or ionization are the two different kinds. And it depends on how the fire starts and how much smoke, if it's a fast spreading fire and so forth. So we don't like to push one type or the other. And I tell everybody, if you're worried about it, they have a dual smoke alarm out there that has both sensors in it. So you can get one that has both types, and then you don't have to worry about it all. But we just want people to have it. Just one of the types will be awesome for them to have because that's going to give you the time it needs, or it should give you the time to get out of your house. Not always, but without that, you're at a real loss.
Yeah. And I will actually add to that. So we talk about, the photoelectric ionization, but the technology has come a long way, as we know, with everything. And they do actually have the lithium battery alarms now.
Okay.
So that's something to add to, people forget to change their batteries or check them and things like that. And I think the lithium batteries, they tend to be a little bit more expensive, but there are ways to get them installed for free all over the state. Doesn't matter what your income is. We're happy to, give you some supplemental ones, but the lithium battery ones are where it's at because it's already in there. You just kind of twist them around and it's activated and you don't have to worry about it.
So in saying that, lithium batteries are good for 10 years. And that's all a smoke alarm, the sensors are made for, is 10 years. So if your smoke alarm is older than 10 years, you need a new smoke alarm.
Oh, good point.
So when we've been doing installations over the last 4 years, and a lot of partnering with the American Red Cross, we've been keeping, not with the person's personal information, but just the address, that this house had smoke alarms installed on this date. So 10 years later, we know it needs a new smoke alarm. So we're kind of working ahead on that because they all have to be replaced in 10 years. But the lithium battery is good for 10 years. If you have any other type that have a battery, usually they're 9 volts, but they could be others, those need to be tested once a month, and then twice a year you need to change them. So that's a lot of responsibility to have to do that when you consider you can buy one that's good for 10 years.
Yeah.
We're going to take a short break and we'll be right back.
Now that fall's here, it's time to start thinking about getting your flu shot. Even healthy people can get the flu, and it can be serious. That's why everyone aged 6 months and older should get a flu vaccine. The flu vaccine can reduce flu illnesses, doctor's visits, and missed work and school due to flu, as well as prevent flu-related hospitalizations. This season, protect yourself and those around you by getting a flu vaccine. Stop by the Kanawha-Charleston Health Department at 108 Lee Street East in Charleston, or make an appointment by calling 304-348-8080.
We're back with Robert Sharp and Courtney Rosemond of the West Virginia State Fire Marshal's Office. Moving on from the smoke detectors. If you do wake up to a fire alarm or smoke alarm, or you see smoke, what's the best way to get out of your house?
Well, get low and go. You need to get down low underneath the smoke, and there's lots of people say like a baby, crawl out. And unfortunately, a lot of our people can't do those kind of things. We have a lot of seniors. So that, puts them in the smoke element. And today, way different than maybe our grandparents' time, things aren't made on natural materials anymore, like wood and cotton and things like that. Things are made of synthetics, plastics, and things like that. So the gases in that smoke are very deadly. Sometimes a couple breaths and you're unconscious. You're not going to be able to get out of the fire. So that's why you want to stay low under the smoke and the hot gases and get out.
And I think it sounds simple, and it's what we practice, with our little kids. We tell them firefighters are our friends, but get low and go is something that's so short, but anyone can remember it. We're teaching kids, and to tell an adult that, they're like, okay, but it really, just get low and go. It's all you need to remember.
Get low and go. I like it.
And today they say once the smoke alarm activates, you have about 2 minutes to get out of the house. So that's a lot less than when we had all these natural materials in our house. So it's quickly. So you don't want to fool around, grab your belongings. For your life, you need to get out.
That's an excellent point. And I was going to ask, how long does it typically take before a fire really truly engulfs a home and decreases your chances of getting out?
Well, engulfing the house, smoke, we want to talk more about the smoke and the flames. It takes a lot longer,
Okay.
But the smoke will travel very quickly through your house.
So we're saying 2 minutes or less. Once that fire alarm or smoke alarm goes off, you should be out of the structure within about 2 minutes.
Yeah, and try that sometimes. It seems like 2 minutes is a long time, but it's not that much, especially if you're crawling and if you got to go downstairs, crawling backwards downstairs and, getting outside, unlocking a door. It takes more time than you think.
Yeah.
That sounds like something we should be practicing, especially with children, practicing get low and go and actually going through the fire drill of what it would be like in that situation. Is this what you're teaching the children, or do you have some advice for parents?
Oh, yes. And we have on our website, we share it often, is escape planning. Make sure you know 2 exits. Take a look at that sheet. I tell people all the time, just put them on your refrigerator, where the meeting place is outside, know how to get out, practice on it. If you have maybe your older parents living at home, if they have some mobility issues, we see a lot of people that, we mentioned we do have some working smoke alarms in some of those fatality fires, and the issue is mobility, is getting out. How are you going to get them out? I know a story of a representative actually from NFPA. Her father had some mobility issues. Her mother said, oh, well, I'm just going to grab him, put him on a sheet, and I'm going to pull him down the stairs. And she said, okay, do that right now. She couldn't move him. Sometimes when we are in that fight or flight, it is a little bit, different. However, really make sure you can do it. Opening windows and doors. I think we're so vigilant to keep people out. How are we going to get out? It's something to really consider. People just boarding up different exits, different means to get out, and doing that can, it can really hinder your escape plan if you can't get out your bedroom door or whatever it may be.
That's such a good point, especially we're talking about children, but even elderly or people who may have different abilities or disabilities, trying to get them through and executing that. Yes. That's very good advice.
Yeah,
I appreciate that.
Move your bedroom if you have to. It sounds kind of like a big ordeal, but if there ever were a fire, getting out would be one of the most important things you can do to save your life.
Absolutely.
Another initiative that goes on that was today, and there's a couple of different ones around, but it's close before you doze. And what it means is close the door to your bedroom before you go to sleep. And a lot of people don't do that, but that's a great fire barrier, and also will keep some of the smoke out of your room before you go to sleep. Because what if you're trapped and you can't do your exit through the door down the steps? Then you got to go to your window. So then you're trying to keep all that fire and smoke out of your room for as long as possible. So there's a lot of effort to put out to say, close before you doze.
Close
a
the
very
doors.
simple thing.
So how often do we see fires related to smoking?
Well, nationally, smoking was the leading cause of home fire deaths for a 5-year period, as the statistics have told us from 2012 to 2016. So overall, 1 of every 31 homes that where smoking materials started the fires have resulted in a death. That's pretty high.
That is high, yeah.
So smoking materials, you can attribute it to a lot of things. Matches, cigarettes. In my time as a firefighter, we also saw some correlation to people that would be using alcohol and falling asleep and while they're smoking, and they would be sitting there in their chair and their chair's on fire, and things. Of course, if you have alcohol in your system, then you're not reacting like you would normally would or waking up, so the fire burns longer, and we've seen some of that too. So
definitely something to consider. We are moving into the wintertime, and typically I think this is maybe a busier time that we see fires. What time of year do you see the most fires in West Virginia?
Yeah, I'd say December, January, and February. We were discussing that may not necessarily mean it's the most fatal fires, but there are much more fire calls. We keep track of a lot of that information from fire departments, and that is typically their busiest time of year. And I also think the holidays go hand in hand with that. We're all jolly, and Thanksgiving and Christmas, the New Year, things like that. I think people are a little bit complacent, if you will, and so I think that's a same thing, kind of, but statistically it is those months, December, January, and February.
Okay, kind of changing roles from what to do when you experience a fire. Let's talk about prevention. So what is the most important thing that people can do to prevent a fire?
Well, number one, don't think it can never happen to you, because every time we go on a fire, that's what we hear. I never thought I'd have a fire, So, and sometimes that leads to why they didn't have a smoke alarm in their house. So, plan to have a fire, and then if it happens, you're prepared. One of the leading causes of fires is unattended cooking. So be pretty vigilant while you're cooking, and sometimes set you an alarm or something. Most people have cell phones today, so maybe set your cell phone if if you're on, and then again if you're on the phone, you won't forget about that. So cooking fires is a big cause of fires. that you could be, I think they could be preventable. Smoking materials and being careful with those, whether it be matches or cigarettes or other things. Unattended candles. Your HVAC system turns on and it blows air. Sometimes maybe a candle gets knocked over or drapes get blown into a candle, cause a fire very easily. And then space heaters, and a lot of that's just because people don't really know how to use them correctly.
I think just paying attention, trying to, we always say we want to make sure that 911 call never happens. We want to prevent it. So.
Let's talk a little bit about fire extinguishers and what we should know about those.
Sure, those are secondary. I think after a smoke alarm, a fire extinguisher is a great thing to have in your home, and where you place those or have them is important too, because you want them so that you're not trapped in a room, so that if you use all of it, you still got your back to the door, so you can just turn and run. So having those in your house, and you can get those in all sizes. We recommend what they call an ABC extinguisher. It'll take care of most types of fire. A is we kind of ash, things make ash. B is like boiling liquid, which would be like gasoline, grease fire, stuff like that. And C is electrical current. So that's how you get the ABC as far as the distinguishing factors for what type of to buy. And then we like to use the word PASS, PASS, on how to use one. Because people think, well, firefighters use fire extinguishers, they're not for us. But really anybody can use them. So they have a pin. You have to pull, so P, pull the pin. A, aim it at the fire. S, squeeze the handle. And S, spread or sweep across the base of the fire and just keep on until it runs out. Keep doing that, don't stop. And then when it's out, it's time to get out of there. But don't ever not call 911 before you do this.
Great advice.
Get the fire department. They're coming on the way. Even if you put the fire, think about it. Let's say that you don't get it out, then you've wasted a lot of time when the fire department could be on their way. So I should back up and say that, but using the word PASS can help you remember how to use it.
Great. Calling 911 always first in the event of a fire, and then the fire extinguisher, PASS. You guys have a lot of great acronyms in fire prevention.
I know.
So any last bits that parents should be teaching their children about fire safety? Any last advice there?
I think just being proactive, working on your home fire escape plan, making sure you have working smoke alarms, make sure they're in your child's room, make sure they know what it sounds like. A lot of times, your younger kids, and especially children with autism and things like that, will sometimes be afraid of that loud noise. So make sure that they know what it sounds like, that they're not afraid of it, and you practice. They do a lot of demonstrations of just doing it in the middle of the night, not warning your kids, and what are they going to do? I know teenagers, they may not want to listen, and they just want to go back to bed. I know they enjoy their sleep. I know it's back to school. They're trying to get that every, last bit of sleep on the weekends and things like that. So I think just letting them know what it sounds like, practicing where their meeting place is, what to do in a fire. And then, don't cook when mom and dad aren't home and you're home alone. Candles, don't play with those, matches, things like that. Really pay attention. We love, roasting marshmallows, things along those lines. Just being careful and being proactive and really taking time to go over it, I think is important.
Yeah, with children, if depending on what kind of batteries you have, we would practice. We had, twice a year, we would take like a broom handle or mop handle and just hold it against the button on your smoke alarm and make it activate. And the kids, we'd make them get in bed, and then we would have them practice, going to the door, feeling for the door if it's hot, crawling down the stairs backwards, and then going outside and actually meeting at our meeting place. So that's what we would do, with our children. And then the other thing, there's been some studies that children don't wake up to the smoke alarm as well as adults. But they make some now that can be a recorded voice from the mother or the father, that they're more apt to wake up. I know teenagers and parents of teenagers would say just the opposite. If we're talking about children, younger children, when they heard their parents' voice, and you can actually record your voice on some of these smoke alarms and wake them up. I've seen some studies. I don't know how that works, but they say that that's another option if you have that concern. Because I know some parents say, well, I tried my smoke alarm after my child went to bed, and they never turned a head, So the other thing to think of is when you really have young children, you may have to go you may have to get to them, wake them up, and get them down the stairs yourself, or get them going. So that's another thought. You got to think about these plans.
Always have those plans in place. And I tell you what, I have learned a lot today about fire safety. So Bob, Courtney, I appreciate you both being on the show. I appreciate you both being here and educating our public. Any last words before we sign off?
No, I think the only thing is, if people are looking for fire safety information, head to our website. It's firemarshal.wv.gov. You can just do a Google search for West Virginia Fire Marshal, and certainly follow us on our social media, which would be West Virginia State Fire Marshal, or Facebook and Twitter.
Thank you. Thank you both for being here today. Until next time, stay safe and stay healthy, Kanawha County.